أهلا وسهلا.
أهلا.
Dr. Opada Alzohaili, good morning. How are you doing?
Good. How are you, Kiva?
Good. Excellent. So Ramadan Mubarak. I know this is a special day and special week. Actually, Ramadan will be starting on Tuesday. So congratulations. And for people who are fasting, I think it's important to address some of the issues related to chronic health problems, especially diabetes. So by the way, this is a program that we started a few months ago, and it's focused on health issues, mostly COVID, global health issues. And in this special month of Ramadan, we're going to be addressing some of the issues relating to fasting and the impact of fasting on health. And we are privileged to have with us Dr. Opada Alzohaili, who is well known at the regional and the national level endocrinologist, specialized in diabetes, of course, and any and other endocrinologist conditions. And he's been speaking on diabetes and treatment all over the country. He's based in Michigan. He's also a member of the board of MedGlobal and also past member of the board of the Syrian American Medical Society. So welcome, Dr. Opada. And we're going to have this conversation about questions related to fasting and chronic diseases, especially diabetes. So you want to introduce yourself for people who do not know you?
Thank you very much. Thank you, Dr. Sahlul, for inviting me to this. I like the setup. I like it's nice, and especially now, just before Ramadan. It's one of the topic that it really dear to me, because I've been trying to kind of find what is the best way to help people with these chronic diseases, especially in diabetes and medication. There's so many questions, most of it unanswered. There's a lot of experience we had over the years and try to collect data on what's the best way to handle these diseases. By the way, I'm Dr. Opada Alzohaili. I'm an endocrinologist. I was trained in Damascus University, graduate 1990, and I've been in the United States since 1992. I had my endocrinology fellowship training at the Cleveland Clinic, and I've been practicing in Michigan for the last 25 years. Privileged because I practice in an area where there's in Dearborn, where there's people from all over the world. So I had experience to treat people from different colors, different background, different countries. I think I had a patient a few days ago from a tiny small country in Africa, never heard of it. And I was so excited because I think that complete the process for me. Like, I've seen a patient from every country in the world. And also I've seen a patient from every state in the country, in the United States. So that makes you kind of have a prospect of or more a better vision on how these chronic disease different and how people are different culture, different background, different places. So it's a privilege to be in Dearborn because, again, you see people from all over the place, and you tend to kind of see how the culture differences change approach to chronic diseases. So we're a very busy practice. Again, I'm work with the 8 other endocrinologists in our practice called Metro Endocrinology. And we're very busy where we do different things, and we try to have a special interest, things that will be like our office will be known for, like a thyroid radiofrequency ablation, pituitary testing, using pumps for adrenal insufficiency. So things will be known for, so people will come to us from all over the country and the world, ask us about it. The issue with Ramadan has been really sensitive to me because I've been talking about this. I wrote about it. I wrote different articles, different things. And for the last 6-7 years, I've ran my own studies. I couldn't get a grant to do studies, big studies, but I ran my own studies every time because I have at least 1,000 of my patients fast in Ramadan, and I always encourage to fast in Ramadan. So I always collect data in terms of levels, monitoring, to try to collect my own data. Say, okay, how can I help these patients when I collect more of these data?
So, Dr. Opada, you also have been in Yemen also with the medical mission, with MedGlobal. You've been in other parts of the world. And you told me one time after the mission in Yemen, in Hadramaut, is that people still in Yemen adjust their medications for diabetes based on the Western style of diet, but their dietary habits are different, and they have to do it differently. That's why many patients that you've seen in Yemen have uncontrolled diabetes, because they adjust their insulin and other medications based on the Western diet, but they also take, you eat the usual Yemeni diet with high carbohydrate and starch and bread and rice, and that's not helpful. But let's start with first of all, if you're preparing to Ramadan, like many Muslims who will be fasting in Ramadan, and you have chronic disease, whether it's diabetes or hypertension or cardiovascular disease or COPD or chronic kidney disease or even cancer, how should you prepare? What should you do mentally? What should you do in consultation with your physician? Can you or should you fast if you have chronic disease? And of course, chronic diseases, NCDs, are very common. 200 million Americans have chronic diseases. It's the cause of 2/3 or 75% of all mortality, death in this country. Obesity is one of the chronic diseases, which is also 2/3 of Americans have obesity. So how do you prepare for Ramadan if you have chronic disease?
So that's a great start with the question. So again, I mean, and a lot of people have a chronic disease in the country. If we're talking in terms of how many Muslims all over the world that like to fast, we think there's probably over 150 to 200 million Muslims who are diabetic, who wants to fast. We think there are probably 50-60% of the Muslim all over the world, which is, we're talking about 600-700 million people who are Muslims who wants to fast, and they have chronic diseases, including diabetes and other stuff. So, so for them, it becomes really important to see, okay, first, how do I know I can fast or not? Because the rule, Allah subhanahu wa ta'ala, God said that one of the things I want you to fast, but if you think fasting will harm you, will harm your body, that you should not fast, it becomes actually a sin. It actually, if you think, if I fast, I'm going to knock out my kidney or kill my liver, but I want to fast because I want to please God. No, you're not. You're probably committing a sin, because the rule do not harm yourself. So the first question you have a chronic disease, you want a preparation. You can't just come to Ramadan day first one and say to start calling people and watching shows and you say, okay, what should I do? Can I fast or not? Let me consult here and there. It's too late. You want to do it a month at least in advance. You want to check with the doctor that they see you for these chronic diseases. Say, you know what, I'm a Muslim. Or if you see a Muslim doctor, I'm going to make it easier. If not a Muslim doctor, you also have to explain to him. When I came to this country first, when I talked to the endocrinologists, when I explained fasting to them, for them, everybody who asks about fasting say, oh, absolutely not. It can kill you. It can harm you. Then as we start collecting all the data and found out that it's not true. That's why I'm saying sometimes it's important to reach the Muslim doctor to understand the importance of fasting, what exactly happened in fasting, so they can give you an honest opinion, whatever that specialty is. So if I have a chronic condition, a month before Ramadan, I'll come to my doctor and say, I really like to fast. What are the things I can do now till Ramadan to make sure my chronic disease is stable? How can I control my diabetes, switch to medication that does not cause low sugar or damage in Ramadan? If I have a renal failure, what degree I'm in that renal failure? Should I change medication before? Again, whatever condition is, from pulmonary or GI or cancer, certain thing the doctor can do, say, you know what? I think if we made a little switch for that month, we could probably let you fast. We'll monitor this. But in order to make sure you're okay, let's make the change in the medication now, see how they affect you. Second, let's run some blood work. Let me examine you just before Ramadan. So if you have a renal failure, stage 3, for example, I want to make sure, let me check your blood level of creatinine or check your kidney test just before Ramadan. And if suddenly just before Ramadan, I see your kidney tests are getting worse, and I'm going to tell you, probably you shouldn't be fasting. Same thing for diabetes. Like patients with diabetes, just before diabetes, let me see you a month in advance. I'm going to write you a medication, see which one can cause a problem in Ramadan. And we'll talk in detail about these medications. Let me switch you to medication that will be less harmful. Let me check your blood pressure, blood sugar. Let me get some blood work. Make sure you are safe, good, in good condition to be able to fast. So I'm going to prepare everything possible for you to be able to fast. Now, I may come at the end to tell you, you still can't fast because, unfortunately, one of these things are wrong. But for you as a person, you want to prepare, but let your doctors know at least a month in advance so they can help you. And it's good to consult with a Muslim doctor who is known in the specialty so it can give you a better opinion honestly about your fasting.
So the key here is planning and preparation. You need to consult with a physician who knows about fasting, because some physicians may, especially if they're not from the Muslim faith, may think that fasting is similar to other fasting, which is only abstaining from certain food. But you need to explain to your non-Muslim physician that fasting means abstaining completely from food and drink, and of course smoking, from sunrise to sundown, completely without eating anything or drinking anything. But if you have a Muslim doctor, that will make things easier. You need to get some blood work if you have chronic disease, and there should be or could be adjustment of medications. So in general, what's the impact of fasting on blood sugar control and other health benchmarks in general? There is a tradition in the Muslim text that, fasting may make you healthier. صوموا تصحوا. Is that correct? Is fasting, does it cause improvement in health benchmarks, blood pressure, blood sugar, weight, or studies have not shown that?
That's a great question, because it's really depend on how we approach fasting, what we do in fasting, and also what kind of condition you have. So to start with, there's a lot of studies that looked in Ramadan in Muslims. So they looked at blood sugar control before and after Ramadan. And disappointingly, a lot of these studies showed that sugar control actually get worse. Hemoglobin A1C, the average blood sugar, got worse after Ramadan. And also there was studies done in Muslim countries, multiple Muslim countries, where they looked at weight and they found out actually the opposite. We think people lose weight in Ramadan. Actually, most people actually gain. So some of these countries showed worsening of the blood pressure, worsening of blood sugar, and worsening of obesity. So that is some study. But also there's other studies were done nicely, also different scenarios showed the opposite, improvement. I think the difference between the study showed improvement and not is what exactly the behavior you're doing in Ramadan. So I'll give you an example. If I have diabetes, my worst enemy with my patient is their ability to control their fasting. I have to get my head at the level of your head. It looks weird. Okay, now it's better. I look like a monster, so it's better. So if I have diabetes, I want to come to Ramadan, and if I have, first, take medication at a time, and we'll talk about adjusting medication. If I eat correctly, the way Prophet Muhammad ﷺ is explained, you fast with the dates, you pray, you come back, you eat, then you go pray again, and then you have suhoor. So it'll be smaller, multiple meals. This is how it should be. When you do it that way, actually in terms of the weight, the sugar control, and the blood pressure control, cholesterol control, all these will improve. But if your behavior I'm sitting at home, I can't wait till 5:30, 8:30, whatever Maghrib is now. As soon as the adhan come, I'm going to eat everything on the table. I'm going to not even breathe. I'm going to just immediately start drinking juices and liquids and then food and meat and bread and then tea and sweets and fruits after that, and then juices after that full of sugar. And then pretty much eat for the next 2 hours, then they can't breathe after that because they ate so much. That's definitely not healthy. Your diabetes, your blood pressure, your cholesterol, your weight is going to be a lot worse after Ramadan. So it really all depends on the behavior. If you do it exactly what Prophet Muhammad Sallallahu Alaihi Wasallam intended, what Allah thinks Subhanahu wa Ta'ala intended for this facet to be, is you train your body to control urges. I mean, that's the whole thing. Is لَعَلَّكُمْ تَتَّقُونَ. Is the whole thing. Is I want to train my body that something normally I do easily, which is drinking and eating. Now, a certain time from this state to this state, I can't drink, I can't eat, and it has to be from this time to this time. So that means people who tell you, well, I can't stop eating sugar, I can't stop eating this, I can't do this, I can't do this. They pretty much in Ramadan say, you can't. Oh, what it needs a little training where you actually control your urges and you can behave in Ramadan in a certain way. And that's why that control of your urges will help you be a better person. Will help you not only in terms of health and food and eating habits and sleeping habits, but also train you how to be a better person, more pious, how you treat people better, how you be a better to your neighbor, to your family, to your friends, and generous person. Now, all of these is, again, you train your primitive desires of eating and drinking by doing this. Now, if you train them well and you follow these instructions, you're going to be doing fine. You'll actually, it will be great for you.
So the key is disciplining your body and your also mind. So Ramadan is a month of discipline. So eat small portions, eat gradually. I mean, when you break your fast, you start with a small portion with dates or some water, and then go to prayer, then go back and eat the main meal, and then another small portion at suhoor. But if you eat more than usual, if you eat sweet every day and you don't eat sweet every day before Ramadan, you're gonna gain weight. Your blood sugar will become out of control, and any benefit that you get out of fasting is nullified by your practices that actually are very common within different culture. We tend to eat more sweets. We tend to eat large portions. We tend to sleep, or in some countries they tend to sleep during the fasting and eat during the night. So any benefit that they're gained from fasting is nullified by these practices. Now, which patients with diabetes are encouraged to fast? You have diabetes type 1, you have diabetes type 2, you have diabetes type 2 that patients are on insulin. So which one can fast and which one cannot fast? For example, diabetes type 1, who of course are on insulin, are they supposed to fast?
So there's two different kind of diabetes. So there's type 1 diabetes. Type 1 diabetes, you have beta cell doesn't work. This used to be called juvenile. We see type 1 in 80 years old. We see it so we see type 2 in 5 years old. We see type 1, the juvenile one, we see in 80 years old. So the age is not an issue anymore. It's like 1 and 2. 1, beta cell don't work. You are on 4 shots of insulin or insulin pump. The rule for these patients is they should not fast. Though there's patients who really insisted and they say, you know what, I want to do anything to be able to fast. So in this scenario for some type 1, again, my general recommendation, if you have type 1 diabetes and you take 4 shots of insulin a day and you're high risk of diabetic ketoacidosis or renal failure, don't harm your body. Don't fast. I may change my mind when fasting becomes short. Like, let's see, in January, fasting comes from 7 in the morning till 5. You may be able to do it. But now when Maghrib is 8:30 and you stop eating at 5 in the morning, that's a very long day. There's really high risk of hypoglycemia, DKA complications and problem, and renal failure. Some of the medication you take for diabetes are diuretic.
Death, right? Hypoglycemia can cause death.
Exactly. So again, you do not harm yourself. Now, there's really exception, very few type 1 that are well controlled on insulin pump with a meter, with a continuous monitor. So they have data 24/7, and they have data actually on their phone, and they even have the data transmitted to our office. So I can be in my office and I see your sugar all day, and I can tell you when to stop fasting, or you can look at it yourself from your phone. So there's certain condition in an extreme when you have all these measures, you can fast. But in general, if you have type 1 diabetes and you don't have these things available to you, do not fast. all endocrinologists have agreed on this because, again, the harm outweighs the benefit. Now, if you have gestational diabetes, so you have a diabetes when you're pregnant now, and there's also two kinds. There's gestational diabetes. Diabetes became evident only during pregnancy, and you have to take insulin 4 shots a day, and the sugar control affect the outcome of the baby. Don't harm your baby. Don't fast on Ramadan. If you have gestational diabetes and you're pregnant and you are just on a metformin or a diet and exercise, and there's really your pregnancy is not high risk, you don't have other condition. So I'll tell some patients, again, as long as you hydrate well at suhoor, you follow the instructions, you eat well, healthy, and again, monitor your sugar and blood pressure during the day, you can fast. So that's the second type. So they also part of here. Now, type 2 in general, they should fast. Type 2, we even have a lot of now this called the fasting diet. It's probably the most common. After keto, everybody's now doing this fasting, prolonged fasting and fasting diet, and the effect of fasting on weight loss. It's very popular, and it's actually very healthy. And you follow, as long as you monitor electrolytes and make sure you take vitamins and drink enough water, fasting diet has been actually helpful. It helps also diabetic. So in general, type 2 diabetic, if you are on pills, definitely you should fast. If you are on 1 shot of insulin a day, like a long-acting Lantus Humalog, you can fast, and we can adjust your insulin doses, cut it, monitor it to keep your sugar control during the day. If you are on 4 shots of insulin a day as a type 2, maybe you'll become like type 1. Maybe it's not a good idea to fast. Though, if you monitor well controlled, I usually adjust your insulin. So I'll give you a big dose of fast-acting insulin just before Maghrib, and maybe tiny little one just before Suhoor. As long as you have continuous monitor, you'll be able to fast as long as you monitor your blood sugar well. And the idea is say, as long as you feel low sugar or high sugar or have symptoms, immediately stop the fasting, because Allah said, don't harm yourself. That's a basic rule. So in type 2, the majority can fast unless you have 4 shots a day and you're really brittle, where your sugar go up and down unexpectedly. Now, the subset of diabetic who absolutely should not fast in any of these 3, diabetic who have renal failure. If you have renal failure in the stage of 4 and 5, don't kill your kidney. Fast is not going to be good for you. These are definitely, I've seen people damage their kidney during Ramadan because insistent of fasting. Especially, we have habits. A lot of people don't have suhoor. They say, well, I don't have suhoor. I just eat a lot, like 7,000 calories at iftar, and I can't breathe. Then I go to sleep. I don't wake up for suhoor. That's the biggest mistake, diabetic or patient with renal failure. I tell you, have to wake up at suhoor. You have to eat something at suhoor. You have to drink a lot of fluid at suhoor to make sure that you're well hydrated during the day, to make sure you don't kill your kidney during the day. So the subset of diabetic that absolutely should not fast are the people who have advanced renal failure, because it's going to make it worse.
So for type 2 diabetes, so the key here is that you consult with your endocrinologist, not any physician, someone who is really into diabetes control. The key here is close monitoring during Ramadan. That means not only once a month, but every day you need to monitor your blood sugar control, and your physician need to be aware of fluctuation. And the third thing is to plan well by adjusting your medications. And also the way that you are breaking your fast and preparing for the fasting with suhoor, you need to adjust to make sure that you abide by certain instructions, hydration, what type of food you eat, things like that will make it easier on your health. And if you have certain conditions, which is type 1 diabetes, or type 2 with multiple insulin shots, or you have chronic kidney disease, then you should not be fasting. Now, if you have type 2 diabetes and you are on oral medications, metformin, other hypoglycemic medications, and there are plenty of them right now. I'm not up to date on this. You are the expert. What should you do with adjustment of oral medications if you have type 2 not on insulin?
So yeah, you can't be updated. There's no way, because there's probably now 75 different medications for diabetes. There's probably 50 insulins and 70. We can't keep up with the names. But in general, if you group them together, We're lucky now because we have so many medication now for diabetes that does not cause low sugar, does not cause dehydration, does not cause a problem. Metformin in general, I will take most people on metformin. I tell them metformin, you can take it instead of taking it twice a day. In Ramadan, you take 2 pills with dinner. So the full dose, take it with iftar. You don't have to take it at suhoor. You should be fine. Of course, unless you have renal failure. The older medication we call the sulfonylurea. If you're on a glibazide, a glimburide, a gligazide, and glibenclamide, amytal, so glucotrol, all of these are called the sulfonylurea group. These groups have high risk of hypoglycemia. These drugs should never, never, never be given at suhoor. I tell my patient with this, if you are on, for example, sulfonylurea, glucotrol, 10 milligram twice a day, before breakfast, before dinner. In Ramadan, you take one before iftar, nothing before suhoor. So in any of that group, if you are on 2 a day, take just one before iftar and forget that the one before suhoor. If you are on 1 a day, just take it at iftar and you should be okay. And take it immediately again. When you take the dates and water, make sure you take it, then pray, then eat. Because sulfonylurea has to be given 15 to 20 minutes before meal to work. But the newer drugs, like DBB4, Januvia, and pioglitazone, injections, we have these injections, GLP-1 injection from Byetta, Ozempic, and so many of these, the same group, and they have a different name outside the country, around the United States, but they call them the GLP-1 injections, once a day or once a week. Drugs like DBB4, which is 7 or 8 different drugs in different name, Januvia, Galvus, so many, again, Tradjenta. These can be given just like outside Ramadan. These have natural protection from hypoglycemia. GLP-1 will stop working when your sugar less than 80. So you can overdose on these medicine any much you want. You will never get hypoglycemia. So they are extremely safe in Ramadan. And if there's a choice to change, and we did actually a study in our office, we put continuous glucose monitor on around 250 patients in Ramadan. And then we looked at the data and we did a really nice statistical analysis based on the drugs. Like, what are the decision making before Ramadan? How do you adjust your medicine? And we found out that DBB4 drugs like Januvia were the safest, the easiest, once a day, zero risk of hypoglycemia in these patients. Again, this is not by patient. This is by our 24-hour monitoring that we put them on for 4 days or 7 days. The GLP-1 injections also safe. They don't cause hypoglycemia, but you got to be careful. Do not start GLP-1 at Ramadan because some of these drugs can cause nausea and vomiting, and the last thing you want to have is nausea and vomiting in Ramadan. So these injections, do not start them at Ramadan. Maybe start them a month before to be ready for Ramadan. The last group of drugs, the most commonly used now, the SGLT2, Jardiance and Farxiga, the Flozin, all the Flozin, like 6 or 7 of them. Now, these are great drugs. They don't cause hypoglycemia. You can take them in Ramadan safely, but remember, they are diuretic. They cause 300 cc of diuresis. They drop the blood pressure. So if you are on the diuretic and in Ramadan, you're going to fast for 18 hours, there's a risk of renal failure, there's a risk of dehydration. So my patients on SGLT2, I will tell them in Ramadan, take it at iftar time. You have to wake up at suhoor and you have to drink a lot of water. And if you are on any other diuretic, weak or combination with a blood pressure medication, you have to stop. And you have to monitor your other blood pressure medication. If your blood pressure is always like 110 with the blood pressure medication, if you are on Jardiance in Ramadan, for example, you need to cut down your other blood pressure medications so you don't have hypotension. And you know, hypotension in Ramadan can be potentially cause not only arrhythmia and passing out, a syncope, but also renal failure, heart failure, and arrhythmia. So it is very serious to have low blood pressure. That's why it's important to adjust your blood pressure medication when you're on an SGLT2. So if you're on an SGLT2, Jardiance or Farxiga, you got to talk to your doctor, make sure he knows all your medicine, Make sure you take them at iftar. Make sure you drink a lot of fluids. The DBB for a GLP-1, you don't have to do anything. Do them exactly where you used to do them without any adjustment. If you are on sulfonylurea, you have to take them only half dose. If you are on metformin, take all the dose at iftar time.
Well, that's very helpful. And it looks like it's complicated. That means you have really to consult with your physician and maybe have written instructions, because most patients, including myself, we're going to forget this. So you need to have a written instructions by your physician about how to adjust your oral medications for diabetes before fasting. So you won't hurt yourself, will not cause hypoglycemia, low blood sugar, and deterioration of kidney function, and death sometimes. So
I'm sorry, but that's a great suggestion, because that's exactly what we do, because patients forget. It happens a lot, and they misread. So we have I actually print a sheet when we write to our patient, medication outside Ramadan, medication in Ramadan. It will be completely different structures, and it will be written. You take it home. You have the patient sign on it to make sure they understood these instructions.
So this is the last question, and it's very important, because overweight, obesity is very common in this community, in our communities in general. 2/3 of Americans are overweight, obese, sometimes extreme obesity. It's one of the risk factors for many non-communicable diseases, chronic diseases like diabetes, hypertension, hypercholesteremia, cardiovascular disease, and others, kidney diseases, and it's a killer. So how can you lose weight in Ramadan? Most of us, and including myself, I noticed that I lose few pounds in the beginning of Ramadan, then I gain them back, and by the end of the month, I'm even. Some people gain weight in Ramadan, especially the ones who tend to sleep more during the day, or eat more sweets during the day, or have less activity. Like most of us, our activities during Ramadan go down during fasting. So how do you suggest, what's the best regimen to lose weight in Ramadan?
So that's really exactly what you said. It's all behavior. There is actually, when they looked at studies in Muslim countries, and there was probably one big study was 27 countries. What mostly was survey. Majority of people gain weight. So it's, but again, there are studies that looked at fasting as perfect for weight loss. One, it all comes back to good behavior. That means you shouldn't be sleeping all day. I mean, you should work. Some people, for me, I'm limited. I can't work the same in Ramadan like outside Ramadan. Not because of food, because of coffee. I get migraine without coffee. So, but I still work, still have a productive day. One of the important things is, what do you do when you break the fast? So I used to be like, for example, when I was in Syria, and even now we're still doing it. 1 hour before iftar, somehow we got a little surge of energy. And I used to play soccer every day in Ramadan before Maghrib. And we actually started doing it last Ramadan and one before, where we gather, play soccer. We're probably not playing aggressive, but we move around, and we come, by the time we come home, Adan is there, we eat. And I used to always get yelled, on by my father, because they said, how can you play soccer in Ramadan? It's like, it really makes me feel good. I really have more energy when I play soccer. The days I play, I actually have more energy at night, more energy next day, the day when I don't play. Because it's all about moving your muscle, burning the food that you eat. But if you're doing nothing all day, your muscles are dead, they're not doing anything, and you just come in and consume 1,000 calories, most of it carbohydrate. Doesn't have to be sweets. People say, I don't eat sweets. Yeah, but you're eating 5 loaves of bread, and you eat potatoes and rice. All these carbohydrates are actually worse than sweets. So you consume all, and then on top of it, we like juices. People consume orange juices and juices that are full of sugar. And then after that, what happens when you have load of sugar, your insulin level goes up, and eventually drop your sugar, and then you can't breathe, you can't move. So you're just tired, you can't move, your muscles not doing anything. 1,000 calories you just had for iftar, guess what are they gonna go? They're all gonna go in the middle. Would say, why I'm gaining fat in the middle? Because that's the fat that cannot be used. The sugar cannot be used after meal, because you're not active, you're not exercising, you're not moving around. It's going to deposit in the fat cells in your belly, and then you're going to have weight gain. So what's the trick here? Small breakfast, you have the date, water, pray, take 5-10 minutes break. After that, start eating. don't eat sweets and don't have a lot of carbohydrates. It's good, a lot of fluids and vegetables and good meat and protein. And then kind of relax. If you can walk to Taraweeh, to go to the mosque walking, if that's a cable, you can do that if it's close to you. Definitely in Detroit and Chicago, that's not a good idea. But it's if it is other places where you can do it, that's great, because that activity is going to help you burn all the sugar that you just consumed. You come back, you have a little bit of snacks. You want to go to sleep, wake up for suhoor and have a small suhoor. Guarantee you, if you do this, you're going to lose weight by end of Ramadan. By having frequent small meals, some kind of activity in between. You still, if you used to exercise before Ramadan, there's time during the night where you'll be able to exercise, even if you 10, 15 minutes. You don't have to do exercise running, but if you exercise, maybe in weightlifting, building muscle mass, we say always help burn the sugar. So you can do 5-10 minutes of weightlifting at night. That also help consume the sugar. But if all what you do is eat and sleep, guarantee that your sugar, your blood pressure, your cholesterol, and your weight will go up. If you're active and you control your eating habit, you should lose weight.
Well, that's very important. One time I heard and I read that you need to cut down 3,500 calories to lose 1 pound from your usual. And if you also added 3,500 calories, you will gain 1 pound. And these 3,500 calories, if you cut down, let's say every day in Ramadan, 500 calories from your usual pre-Ramadan intake of food, then you're gonna lose 1 pound a week. And losing weight, small portion and gradually, is better than losing 10 pounds and then gaining 20 pounds at the end of Ramadan. So small modification of your behavior. Think before you're eating. Eat more proteins, less sugar, of course, or maybe no sugar, no sweets, less carbohydrates and starchy food. Manasif is not good in general, because you have a lot of food and a lot of fat and starch there. So these are the key things. And hopefully you can lose few pounds at the end of Ramadan. It will help yourself. It will help everyone else. Thank you, Dr. Opada Alzohaili. By the way, Dr. Opada Alzohaili is also the son of famous Muslim scholar that I have many books behind me that were written. May Allah bless his soul, Dr. Wahba Alzohaili. Well-known Syria, of course, and throughout the Muslim world. Any last comment? And there are some questions that are asking to have this same conversation in Arabic. Maybe we can do that either tomorrow or next week.
Oh, I'd be happy to do it tomorrow. If you want tomorrow, same time, I'll be happy to do it. I think it's good to have it in Arabic. My last comment will be the usual advice is to fast. It's better for you to fast, because there's so many health benefit and soul benefit to you, other than the rewards and inshallah and acceptance. But even on your own health, it's actually good to fast. Your rule is always try to fast, unless you have something wrong with your body health-wise, you cannot do it. But if you want to fast, first consult with your doctor. The second, make sure you follow all the instructions in terms of how we eat and how we stay active after eating.
Thank you, Dr. Opada, and Ramadan Mubarak.
Thank you. Thank you very much. Thank you for having me. Thanks. Bye.